though the virus was detected in 81 among people in San Francisco, I started reading in 83, 84, and I said, this is something new. And then saw it was among gay community. I said, okay, it's not a problem in India, so let's forget about it. But then as articles came out, they said it can also spread through blood. And then I said, oh my God.
There was a denial of the problem, that's for sure. Not the individuals, but the denial, because the numbers were very few. And if you compared them with other public health problems like TB or malaria or leprosy or something, HIV/AIDS didn't seem to be such a huge problem. And so we were in denial for a long time.
वो बोले डॉक्टर तुम 2 साल तो जी पाई, उसके बाद नहीं जी। हिंदुस्तान में सेकेंड नंबर होंगी HIV की, पहले सिल्वी, सेकेंड नूरी। क्या सिल्वी मर गई, नूरी तो जिंदी अभी तक है, 27 साल हो के 28 साल हो रहा।
January of 86, we said we'll start collecting samples from female sex workers because that's all we had in Chennai. But where do we find it? Because we don't have regular red light areas where we can go and collect. So we depended on the police who raided brothels and hotels and brought the girls to the remand home, went there at 6 o'clock in the morning, picked up this blood, never asked the girls any questions, didn't get their consent. You know, we were most unethical because at that point of time, I had no idea of all these ethics, and 6 of them came positive. The Indian Council of Medical Research wouldn't believe our testing, nor the kits, so they sent the samples to St. Johns Hopkins University, to Tom Quinn's lab, and that's where it was confirmed with Western blot. At that time, we didn't have Western blots, and all 6 came back positive.
World Bank at that time, for the first time, was looking at health and health as a portfolio. So they were willing, and the Ministry of Health in India, barring some population projects, had never taken any World Bank assistance. And you remember 92, we were in a terrible global crisis when we wanted dollars. So there were multiple of these kind of reasons that got together, and we said, well, World Bank wants to give money for HIV/AIDS. WHO is also very interested in flagging this as an important issue of concern. We need dollars, so why not go in for a World Bank funding? So it was really the first loan that we got from a World Bank, of course very, very subsidized loan under IDA.
मैं बताई थी, 1-2 मेरे जिगरी दोस्त लोग को बताई थी। बताने से जिगरी दोस्त लोग को वो बोलेंगे थोड़ा अंगार लगने से चिंगारी जाएगी, नूरी को फैलाने की बीमारी, नूरी को फैलाने की बीमारी। बहुत लोग मेरे दोस्त लोग से दूर हो गए। ऐसा दूर होने से मैं कुछ डरी नहीं।
You know, what was happening was, as we neared the end of 90s, the decade, there was this huge globally also HIV had caught on. It was out from just being a gay disease from US. It had taken on international ramifications, particularly South Africa and Sub-Saharan Africa and so on. So I do remember that way back in 93 itself, when I was the director, we had sent a team of doctors from Delhi, and they went to Lusaka, and they came back with alarming reports saying 80% of the hospital admissions were HIV/AIDS patients. So that kind of did worry us, I must say, but not enough to make us take it very seriously. It was towards the end of 90s that, this whole transmission, the theory of transmission of disease and that the need for, heterosexual route was the dominant route, and need to work with sex workers and other vulnerable groups in a more targeted fashion. That understanding came in 98, with a lot of research that had been done and so on. And there was this very huge international pressure that India was on denial. And they extrapolated and said we must be having something like 25 million cases while we were just declaring 3 million, 4 million and 5 million and so on, you know. So there was this pressure of shaming India in a way, saying that you are not looking at the problem and this denial is not going to help you.
One caution he gave me, that I had talked to MGR, I would say, and you should better not tell them that you are doing this for them. You are examining them for AIDS. Segregating, quite a few persons we had segregated. And another thing, we used to not only treat them for AIDS, we also gave a lot of vitamins, tonics, everything, so that the resistance also improved. So they never felt that they are targeted for AIDS. Immediately, segregation is one of the major things.
I was quite proud that we have found this infection in India, but not the rest of the crowd in the assembly. They said, why did you have to find this here? Because now they would say we are all bad people in Tamil Nadu, we are conservative, we are religious, and it shouldn't be here.
I went to one of the training sessions conducted by NACO at that time, and they had all these consultants, and they did a condom demonstration, and I was horrified. I couldn't believe that a condom demonstration was being done in 2 minutes or 3 minutes, because that's a major part of prevention, and you have to take time over it. You have to engage people, you have to teach them properly. And I said, look, this is not the way to do it. And I was literally thrown out saying, you know, you guys, you come from abroad and think you know better.
In fact, I remember a meeting that the Secretary Health convened, and Kerala refused to come. Kerala government said, we don't see a problem in HIV/AIDS, it's nothing but US imperialism at work.
HIV is a friend for me because I always treat him as a friend, because my parents will leave me one day, my friends will leave me one day, but this HIV virus is going to stay with me till the time I die.